it's convenient to oversimplify, try to make things binary or black and white, but it's just not that simple. Welcome to another Real Talk today with Dr. Lon. We're gonna go on a little bit different of a format here, a little bit longer form, something I wanted to discuss for a while now, give people kind of a insight into my perspective on medicine and health in particular, and why functional medicine is what I practice. So we're going to start with a statement that really kind of sums up medicine for me, which is that every disease exists on a spectrum. And what gives diseases that spectrum is the insane complexity of life itself. Take our body, for example. Each system within our body is remarkably complex. But then you've got multiple systems working together to form a system of systems, which is just insanely complex and nuanced. And that's what leads to diseases being expressed on this spectrum. Now, I think this is one of the main problems that traditional medicine has, is it doesn't fully appreciate that complexity of life, and it doesn't fully account for that complexity. And by not doing so, it's ignoring that spectrum of disease. We all like things to be black and white. We want things to be binary. You either have that condition or you don't. It's just not really the way that it actually works in life. So, for instance, we have set up the diagnosis of diabetes around a set of numbers, an A1C above 6.5, or a fasting glucose above 125, or a random glucose above 200. But is that the only time that there are diabetes-related problems happening in the body? Absolutely not. Even medicine itself does recognize that there's a spectrum of diabetes. They don't call it a spectrum, but the end result is damage to the kidney, damage to the heart, damage to the eyes, damage to the nerves. So there are diagnosis codes associated with the steps down that spectrum. And there's even a pre-diabetes diagnosis now, which is kind of the early phases of that spectrum. But we have gotten so good with our testing. We have gotten so good at our understanding of the pathway by which a condition like diabetes happens, that we can now say, before there's any even change in blood sugar level, that you have a problem if you do not address it that will become diabetes. And you are just way, way early on that spectrum. And so that's what I mean when traditional medicine doesn't acknowledge the spectrum in that complexity. It acknowledges that insulin resistance is a part of the diabetic condition, but actual practicing doctors are the ones who are not adapting. So the real problem that traditional medicine has is it's not adapting its diagnoses to the updated testing, the updated knowledge of physiology, and that recognition of the spectrum of disease. So why? Why is it? Why is it that medicine isn't adapting appropriately? Why is it that medicine isn't acknowledging that spectrum of disease? It comes back to that desire for a very clear cutoff. It's easy, right? To have it be black and white, but it's just not. And we, like I said before, we've gotten so good at identifying the early changes, the early steps towards these diseases and conditions, so we can recognize things much earlier than we ever had in the past. So why is it that traditional medicine now has all this in-depth testing, recognizes that, for instance, insulin resistance is part of the process of developing diabetes, but doesn't want to intervene, doesn't want to test for it, doesn't want to actually acknowledge it in a clinical setting? Well, I think there's two big factors here, big players, I should say. And those two big players are the practitioners and the insurance companies. They want things simple. They want things easy. It's easier for us as providers if we have set algorithms. It's easier for us to design research around set parameters, an A1C of 6.5, right? A blood sugar of 125. But we know it's not that simple. So it's an oversimplification. And when you recognize that and you step beyond that, then you get into the realm of functional medicine, identifying things early, intervening early when you have the first signs of problems happening in a patient. And I think that's the revolution that medicine needs. And I think not acknowledging that spectrum of disease and treating each patient as being somewhere on those spectrums of whichever disease state we're talking about is the biggest downfall of modern medicine. So it's really convenient to paint disease, to paint things as being binary, as being black and white, but it's just not that simple. So you should be looking for somebody who appreciates the complexity of your health. Come find us at RootMD.